But let's begin with that change in Moscow's military strategy. Ukraine is preparing for a robust Russian offensive in the east. New satellite imagery shows a convoy of Russian military vehicles headed to that region after troops failed to take Kyiv. And 7 weeks into the onslaught, there's a new general heading the entire Russian operation, one with brutal experience. Holly Williams reports from Ukraine.
We've been reporting on alleged war crimes carried out by Russian troops during this invasion. But experts say their campaign has also been marked by ineptitude and a lack of professionalism. Now it seems Moscow is trying to fix that problem.
General Alexander Dvornikov is the man who's now in charge of Russia's invasion of Ukraine, according to a US official. General Dvornikov previously led Russian forces in Syria, where Russia's been accused of committing war crimes by the United Nations, with airstrikes targeting civilian areas. General Dvornikov's appointment follows a catalogue of Russian military failures. Russian forces were defeated in the battle for Kyiv and have withdrawn from around Ukraine's capital. The security situation's now so improved. On Saturday, President Vladimir Zelensky walked through the city centre with British Prime Minister Boris Johnson.
We simply wish to keep supporting the people of Ukraine for as long as it takes.
Ukraine claims nearly 20,000 Russian troops have been killed in this invasion, while Russia's tanks and armoured vehicles have been picked off by Ukrainians, sometimes using guerrilla tactics. We've seen their burnt-out carcasses across this country.
Six of them died here.
Russia's now switching its focus to eastern Ukraine. This column of vehicles, at least 8 miles long, was spotted heading there 3 days ago.
President Zelensky said today that tens of thousands of Ukrainians are thought to have been killed in the city of Mariupol, which has been bombarded by Russian forces for weeks on end. Anne-Marie and Vlad.
Holly Williams, thank you very much. So with us now is Jaime Nadal. He's the representative in Ukraine for the United Nations Population Fund. Thanks for joining us. And the Population Fund focuses a lot on reproductive issues, which means women and children. So let me ask you, the World Health Organization has confirmed that there have been over 100 attacks on healthcare facilities in Ukraine since this invasion began. I don't know how frequently this is happening, but what is the impact of a healthcare facility coming under attack?
Well, thank you very much and good morning, and thank you for having me here. Indeed, attacks on health facilities have been happening since the beginning of the war. We've been 46 days now in the middle of this war, and indeed, as you rightly said, over 100 attacks to health facilities. This is more than 2 attacks per day. Many of them have been completely destroyed. Many of them have become completely inaccessible for the population. Some are still operating. Many operators utilizing their basements as makeshift shelters and trying to cope with the situation as best as they can. And I'd like to highlight here that attacks on civil infrastructure like hospitals is a violation of international humanitarian law. It prevents civil population to access much needed health facilities. During these shellings, women do not dare to go to hospitals, which means that hospitals are out of reach for them. When they are in the hospitals, they are in fear of the hospitals being attacked. And again, oftentimes they have to get their procedures, their deliveries performed in the basements of the buildings.
Wow. So what is the overall impact of this war on women and children? We've reported for the last 7 weeks the number of children who've become refugees along with their parents. But now I don't think that we've even spoken that much about the number of children who will be orphaned because of this war.
Right. It's important to bear in mind something. About 25% of Ukrainians have been displaced by this war. A significant proportion of them have been displaced to other countries as refugees in other countries in Europe. About 7 million of them are still in the country. They're relocated to safer areas. In the case of refugees, about 90%, over 90% of them are women and children. they have had to flee the country and seek for safer areas outside of their country. What we do in UNFPA, we are trying to focus on providing those who are on the move, but also those who still are in their original locations with services to respond to conflict-related gender-based violence and sexual violence. Regrettably, we are starting to see more and more allegations of cases of conflict-related sexual violence, while providing those victims, survivors of sexual-based violence, with access to medical services, to health services, to deal with that situation, as well as to get them to access or providing them with access to psychosocial support services is very important. This is what we do. These are life-saving services. And then the other major component of our work is making sure that hospitals, health centers have steady supplies of life-saving medicines and equipment that can guarantee that women have access to life-saving services and will not die out of a consequence that is related to the pregnancy. And we are starting to see many more women now having miscarriages, having preterm births and prolapses that require some complex, quality of medical assistance. This is what we do. We're trying to provide a steady supply of medicines and equipment to the health centers, to the hospitals, to the health system, so those women can receive life-saving healthcare.
I'm curious, as you talked about giving support to women who may have been essentially the victims of war crimes, is part of your role also to look for and collect evidence of war crimes?
Evidence is being collected, not directly by UNFPA, but by partner organizations. Our focus is to take what we call a survivor-centered approach, focusing on the victims, focusing on the survivors, trying to make sure that they have access to those life-saving services that will enable them to overcome the situation. On the one hand, from a clinical perspective, from a health perspective, having access to supplies and to care is something that we call the clinical management of rape. And all the supplies and the quality in medical attention that they need. But also access to psychosocial support services, which are fundamental for their well-being, for the recovery after a situation like that. This is the primary focus of our work. We've been already deploying those kits and that assistance to 4 regions in the country. Those were more affected by the war in the east of the country, but we are getting a steady flow of supplies as we speak.
Jaime Nadal, thank you so much for joining us and sharing some light on a story that I think that, in a situation like this, there's a lot of things to cover. And the story of the health care of people in Ukraine, of the people of Ukraine.
And the women in particular.
And the women in particular is such an important one. Thank you for sharing your insight for us.
Thank you very much.